Washington state now confirms a 10th death as California records its first. The House of Representatives overwhelmingly passed an emergency spending bill worth $8.3 billion. The Senate and President are expected to approve it and sign it. And perhaps most important, the CDC today expanded the pool of people who can be tested for the disease. There's still a lot of questions tonight about those tests. Where are they and what's taking so long? Just a short time ago, Vice President Mike Pence said the CDC was lifting restrictions on testing, saying any American can be tested subject to doctor's orders. Meg Tirrell is following the story tonight. Meg.
Hey, Ty. Well, the U.S.'s capacity to test is now increasing after delays due to an initial rollout of faulty tests from the CDC. In conjunction with the expanding capacity at state and local labs, we're also seeing U.S. case numbers rise. They now stand at more than 150 in at least 13 states. The CDC today broadening its guidelines for testing to allow anyone with symptoms to receive a test with doctor's orders. But experts say the number of tests that can be run here is still limited. I spoke this evening with Dr. Eric Blank from the Association of Public Health Laboratories, and he laid out where things currently stand. As of today, 60 state and local public health labs have verified their ability to run the test and begin testing. These labs can test 100 patients per day. Ultimately, there will be about 100 state and local public health labs testing, meaning the capacity will get up to 10,000 patients per day. Dr. Blank says he expects virtually all 100 or so to be up and running by early next week, and most by the end of this week. Now, FDA Commissioner Dr. Stephen Hahn said he expects to have the capacity for 1 million tests to be run. That depends, experts say, on rollout from a CDC contractor. And the timing of that is not immediately clear. Commercial companies and academic centers also getting up and running. I spoke with Harvard's Dr. Michael Minna, who expects the more advanced clinical labs to have tests available in 2 to 3 weeks, and others by mid-April. University of Minnesota's director for the Center for Infectious Disease Research, Dr. Mike Osterholm, is with us live tonight from Minneapolis. Mike, Dr. Osterholm, thank you for being here. You said on Squawk Box last week, quote, "The absence of evidence is not evidence of absence," about the testing capacity and what we were doing in terms of testing here and the actual presence of disease. How much of the spread, the number of cases in the U.S. right now, do you think can be explained just by our increased testing?
I think almost all of it. We know today that there are likely chains of transmission going on throughout the United States, not that dissimilar from what we see in Seattle. And as we get more testing in the community, we start realizing that there may be outbreaks in other facilities, like the long-term care facility in Washington State. And I think we're going to see a lot more in the way of cases in the next 3 to 4 weeks.
What levels would you estimate, if it can be estimated, do you think we have circulating already?
You know, I can't really say, but I think several things are very clear. One is that the early containment efforts of trying to, in a sense, close the border, shutting down air traffic to China, screening air passengers coming into the United States, was not really successful. We really believe that wouldn't have been successful in stopping it. It may have slowed it down slightly, which in itself is a good thing, but we knew that this wouldn't stop it. And so now what we're looking at is what happened in the Seattle area is if cases have been in our communities for 4 or 5 weeks, and assuming every 4 to 5 days you have a new generation of cases, meaning someone transmits to somebody who then transmits to somebody, we may have some well-established transmission chains already going on in our communities that we'll pick up and finally determine with this additional testing.
Dr. Osterholm, if I want to be tested, whom do I call? Where do I go?
Well, right now you still have to work through your own private physician or a clinic that could order the test. But as Meg indicated in her lead-in, we're now seeing that the ability to get a test is going to increase substantially. Remember, the initial CDC recommendations for testing were really not just about risk. It was about if you had a very limited number of tests, who would you want to test first? And we really needed to test who was on first, second, third, fourth, and fifth, and that's what we're now getting to. So go to your own private physician or a medical clinic that can then order the test.
Just crossing the wires right now, the California governor has declared a state of emergency over coronavirus. Should we expect more states to be doing that? And question 2 is about schools. Businesses have been telling people to stay home. Should more schools be shutting?
Well, first of all, I think this is an example where we shouldn't be playing this game like I do with my 10-year-old in the game of checkers, one move at a time. This is really about a chess master. We need to be thinking about 20 moves down the board. We can anticipate already we will have widespread infection across this country in the months ahead. We need to start normalizing how we live with that. We want to stop as many infections as we can, but we just can't shut down the entire world. If we're going to declare a state of emergency with a couple of cases, then we have to ask ourselves, what are we doing if we have hundreds to thousands of cases in our states? And so what we're looking for right now is the kind of discussion that allows us to actually say, should we be closing large group meetings? Should we be closing schools? There's a reason right now not to close schools because we have little evidence that kids get infected with this or at least get clinically ill, and maybe school closings will be so disruptive with little benefit. That's the kinds of discussions we need to have right now and moving forward.